So today I'm just going to talk about a case we had with a mom that came in with a partial molar pregnancy that was presenting as preeclampsia with severe features at 17 weeks. And while I am going to talk about some of the medicine behind this, a lot of this has to do with the impact of legislation here in Oklahoma. Oh, okay. So just a little bit about molar pregnancies. So the broad category is gestational trophoblastic disease. And basically the trophoblastic tissue in the placenta grows abnormally. And so molar pregnancies are a non-invasive form of that, but they can be or they should be considered as pre-malignant and they need to be treated as such. So these type of molar pregnancies occur in about 1 in 1,000 pregnancies, and there's two forms. As you can see here, there's a complete molar pregnancy and a partial. Specifically today, we're going to talk about partial molar pregnancies. And so those are triploidy. And the interesting thing about them is they can often be mistaken for normal pregnancies because they have fetal parts. And up until about 20 weeks, they can really present like a normal pregnancy. Typically, once you get to about 20 weeks, you see preeclampsia, hyperemesis gravidum, and a large uterus. Complete molar pregnancies, they just have a diploid karyotype and they don't have fetal parts, so they're a little bit easier to see. So a little bit about our patient. She was a 38-year-old G6P0231. She was at 17 weeks and 2 days at this time. And she actually came into the clinic because she had new onset swelling in her legs. She couldn't breathe. She had some chest pain and this headache. At the clinic, her blood pressure was elevated, 140s to 160s over 90s. And so they decided to admit her to the local hospital here. This was an extremely desired pregnancy. She had tried really hard to get pregnant. So this was really important to her. So at the hospital, she came in. They took some labs. And this is kind of what happened. So we have the uric acid was very elevated. Creatinine was 1.2 from her baseline of 0.7. So that's pretty significant increase. Her BUN was a little elevated. Her liver enzymes were okay. Her hemoglobin was low. Her platelets were low. And the most important thing was her 24-hour urine protein was high. I forgot to include it on this slide, but she also had an echocardiogram at the time, which showed an ejection fraction of like 25 to 30%. So she was not doing great. She had a lot of end organ damage, and the decision was ultimately made to transfer her to a hospital where she could see a maternal fetal medicine doctor. And so she was transferred to a larger academic institution. So this is at the outlying facility. They did a transabdominal ultrasound, and what they found was a single injury during gestation, consistent with the established gestational age. Most importantly, there was cardiac activity. The fetal heart rate was 136, which is completely normal. The amniotic fluid levels were normal. They saw the baby moving, but there was an omphalocele, a cystic hygroma, bilateral ventriculomegaly, cerebellar hypoplasia, short and long bones, trident hands, and the placenta was very cystic and about a centimeter from the internal os. They also drew a beta HCG at that time, and it was found to be 554,000, which is very elevated for that point in gestation. So she was diagnosed with a partial molar pregnancy and preeclampsia with severe features. Ultimately, she was treated with a cesarean hysterectomy, and beta HCG levels were trended after that. So ultimately, her ability to have children was taken away from her at this time. So just in general, how are partial molar pregnancies normally treated? So the standard of care in somebody that wants to keep their fertility would just be a suction and curettage, which is, you can do that at 17 weeks. If they don't wish to preserve their fertility, you can do a total abdominal hysterectomy like what was done with her. Especially if a patient's over 40, their risk of GTD, gestational trophoblastic disease, is increased. So it can be considered there. And while it eliminates the risk of a local disease there, it doesn't prevent metastasis. So they kind of have to weigh things. And in someone that desires future fertility, you can start with a suction and curettage. And if that doesn't work, they could have escalated that situation, but it wasn't offered to her. And typically in a partial hydatidiform mole, it's typically always benign. Persistent disease is really low percentage, metastasis is really low. So compared to a complete mole, it's typically benign. So just looking at kind of abortion laws by state, you see that these places that are in red, like Texas, Oklahoma, a lot of the Midwest here, this is where abortion is banned and there are criminal penalties for abortions. Orange is going to be your hostile, yellow is going to be your not protected, and then your blues and greens are going to be your best places to access that. So this is just a little bit deeper of a dive into Oklahoma's laws simply because this case happened in Oklahoma. So recently there was the heartbeat law, and that basically means that physicians cannot knowingly provide an abortion after detecting a fetal heartbeat. There's also the total civil ban, which is the same as the other one, but it also applies from the moment of fertilization, and it explicitly exempts care for an ectopic pregnancy. And then the last one is the homicide status, which could be used to prosecute abortion providers because it considers killing an unborn child to be homicide, punishable by up to life in prison. So the laws kind of overlap, and there's very ambiguous and vague wording that's used because these are laws that are being created by people that are not medical professionals. And so they all say, oh, if mom is, going to die, or mom's life is always going to be important. But it's really hard to establish at what point is mom sick enough that I can provide this service to her without being afraid of losing my license, going to jail, these sorts of things. And so a lot of times when it's these type of situations where mom is doing poor, you maybe have to escalate to a higher like doing a hysterectomy versus doing the suction and curettage because there is a heartbeat there. So the conclusion here is just that under these current laws, the physicians don't really have a clear understanding of when they are and are not allowed to permit a pregnancy to end. And so they did a study in 2023 in Oklahoma specifically, and 25 hospitals, which is 74% of the hospitals they had done this study on, said that a D&C and a D&E are both procedures that can be used to withdraw fetal, placental, or parts and things like that, are typically part of an abortion, and they're not allowed when there is fetal cardiac activity. So you can only do it if there's no fetal cardiac activity. So in this case, they were not allowed to do it because there was fetal cardiac activity, and that is considered an abortion procedure. So at one of these Oklahoma hospitals, it was conveyed that after 16 weeks, it's strictly prohibited. So the heartbeat law in the state of Oklahoma really limits physicians because they're unable to end a pregnancy regardless of the viability. And like I said, a partial molar pregnancy is never going to end in a baby. So this is just some references, and that's all. Thank you, guys.